So let's start off with some introductions, if I may. My name is John Murphy. As I mentioned, I am the coordinator for the Vancouver Coastal Region within SelfManagement BC. Briefly, I have a business management and technology background. I was a volunteer workshop facilitator and master trainer with University of Victoria before I was invited to join UVic on staff in March 2015. And my chronic condition is that I had a mild traumatic brain injury and concussion injury as a result of a slip and fall, and I have self-management experience with that particular chronic condition. So I'm going to let Doug introduce himself.
So I am Doug. I am a volunteer program leader in the Fraser North, which is anything north of the Fraser River. And I live in Maple Ridge. And I have a business and management background. I'm doing some teaching at SFU in the entrepreneurship side. And I also volunteer facilitate a number of the workshops, chronic conditions, diabetes and chronic pain for SelfManagement BC. So my own case, that was diagnosed with MS in 2015, and so I've learned a lot in managing that. So that's what brings me to be part of this.
Okay, thank you, Doug. So let's start off with some definitions before we get into the meat of the presentation. First of all, self-management. What do we mean by self-management? I think we're talking about the tasks that individuals must undertake to live well with one or more chronic conditions. And these tasks could include gaining confidence to deal with things like medical management, role management, and emotional management.
So the thing to keep in mind about chronic conditions is that they are ongoing health conditions, and they're often quite complex. So some examples are heart disease, arthritis, diabetes, asthma, bronchitis, emphysema, MS, Parkinson's, chronic pain, and others. It's not the same as a headache where you take aspirin. These ones, there's many other aspects that need to be managed in order to have a healthy life.
Okay. So just to talk about the difference, as Doug alluded to, between acute and chronic conditions. With an acute condition in the beginning, it's usually a rapid situation. In chronic conditions, as many of you know, it's a gradual onset. The causes of acute conditions, there's usually just one cause, like a broken arm or whatever. In chronic conditions, there are many causes. The duration of acute conditions are often short or reasonably finite, and in chronic conditions, they're quite often indefinite. The diagnosis is commonly accurate for an acute condition, but often there's great uncertainty, especially early in the onset with a chronic condition. Diagnostic tests are often decisive, a blood test or whatever. And in chronic conditions, they're often of very limited value because the cause is often unknown and the situation is complex. The treatments, a cure is commonplace with acute conditions, and a cure with chronic conditions is rare. So the role of the professional with acute condition is that they are responsible for conducting therapy, selecting a way to treat the acute condition. And with chronic conditions, what we found that works well is that there's kind of a teacher and partner relationship between the individual with chronic conditions and their healthcare providers. And the role of the patient, essentially with an acute condition, you just kind of follow the instructions that your healthcare provider gives you. And with a chronic condition, the ideal situation is you're a partner with your healthcare professional, and you have responsibility for the daily management of it. As a part of that team as well, often is a person's partner, spouse, caregiver, etc. So maybe I'll do this one since I'm with UVic SelfManagement BC. It was founded in 2002 We are a non-profit organization fully funded by the province of BC. Our founder and program director from the very beginning is Dr. Patrick McGowan. Dr. McGowan is a prof at University of Victoria, and he runs the program from our offices in Lagna. And there are about 20 people on staff, and they are a mix of researchers, coordinators like myself, and the administration function. In terms of what we've done over the past 16 to 17 years, we have delivered our programs, our workshops in about 160 BC communities. In fact, the self-management programs are actually in about 26 countries and in all of the provinces across Canada and states within the United States. They're actually originally developed and maintained by Stanford University, which has kind of changed its name to SMRC, Self-Management Research Center. And UVic initially and now still has exclusive license with Stanford to deliver the programs and workshops within British Columbia. And an interesting statistic is that 1 in 3 British Columbians have chronic conditions. So in terms of stats, since April 2000 to December, the statistics show that we have run 693 leader training workshops to train our volunteer workshop facilitators and leaders. And over 5,746 leaders have trained with us over the years. A number are still with us right now. They've gone, 16 or 17 years where they've been leading. We have conducted 3,407 workshops, and we've had 38,478 people gone through our programs. And, with all this work we've done, I'm still quite astounded sometimes that there are still many people in the healthcare area and elsewhere that still don't know about our programs. But we're very proud of the work that we've done and the number of people that we've helped.
So in terms of the self-management workshops that are offered, the major ones are chronic pain, diabetes, chronic conditions, and cancer. And then around that, a number of these programs are offered in a variety of languages: English, Chinese, Punjabi. There also are some programs that are online, so chronic conditions, you could take that online. There's a health coach program where it's a bit like phone a friend on the Millionaire Show. You could the health coach will phone you once a week to make sure things are going well. What is your action plan? What are you going to do in the next period? And so the province is divided into a number of regions. So there's Vancouver Island, the interior, the Sunshine Coast, Fraser Valley, North and South, as well as the Vancouver Coastal Region. And then there are provincial coordinators that cover Indigenous or Punjabi or Chinese and the health coach program. So it's a sizable organization when you look at it this way of all of the different things that the organization is delivering across BC.
This is John, just to elaborate a little bit more on the health coach program. This is a telephone support program that's offered primarily to individuals that have gone through the workshop, so that after they've done their 6-week workshop, they continue to get support for 3 to 6 months over the phone. And the health coach phones regularly, and as Doug mentioned, they'll talk about the action plan for the next period of time until they talk next. And we'll talk a lot more about action planning as a part of the program later on in the presentation, because it is a very key aspect of what we teach and learn in the workshops. Some of the common participant problems, the problems people enter the workshop with and looking for support on is problems with medications, not being able to do things, difficulty in dealing with healthcare professionals, difficult breathing, trouble sleeping, pain, fatigue, isolation, worry about work, worry about finances, and that life seems very unpredictable while they're dealing with their chronic condition for the foreseeable future. So there's a feeling of depression, anger, frustration, and fear. And just to add, especially with the chronic conditions workshop and the chronic pain workshop, we get people in the workshops that have very, very different chronic conditions, but many of them experience all of these kind of participant problems that we are listing here.
So in terms of some specifics of the workshops are offered free for anyone, all BC adults with any type of chronic health condition. And you don't need a doctor referral to participate. It's a self-referral. If you see information about it posted, then you can just sign up on the SelfManagement BC website. So it's open to anyone. Spouses, partners, caregivers, and others are also welcome to come so that they can better understand how to help those around them that have these chronic conditions. The workshops are all co-led by pairs of lay people, most of whom have their own chronic health conditions themselves, so there's more empathy or more understanding of what some of the participants are going through. And the leaders are trained in a 4-day training program for each of the workshops, so whether that's diabetes or chronic pain or chronic conditions or whichever, there is leadership training about how do you answer questions, how do you present, how do you engage, and what are the skills that are being taught.
And just to add to that, once the leaders have gone through the 4-day intensive training workshop, they become certified leaders through Stanford and also through UVic. So leaders, when they deliver it, to ensure that the results from the workshop are actually attributed to the workshop, leaders follow a very scripted leaders manual, and the participants attend 6 sessions, and they're 2.5-hour sessions a week, usually over 6 weeks, although we don't tend to run classes during statutory holidays and so on, so some may go on for 7 with 1 missed week. Class sizes are typically 8 to 16 persons. We do not generally run workshops with less than 8 people because the interaction between the individuals is not as strong with smaller classes, and participants get more out of the classes, out of the workshops with 8 to 16 people. All participants receive a very comprehensive book, Living a Healthy Life with Chronic Conditions, and there's no cost at all to participants for the workshop or the workbook itself.
But it's not a free workshop because it's funded by the government. So it's important to point that out because you get what you pay for, but it's funded by the government, not free.
That's true. It's certainly at no cost to individuals that come into the workshop, but it's certainly not free. It is funded, as Doug mentioned. So there's great value to it.
Yeah. So I always point that out because sometimes people say, well, it's a free workshop, so it doesn't really matter and the information's not worth it.
Yeah, absolutely. So in terms of some of the key things that individuals learn during their time in the workshop, one key thing they learn is about the typical symptom cycle that individuals with chronic conditions go through. So from the top going clockwise, they're dealing with their disease or their chronic pain, which often leads to tense muscles, restricted movement, ineffective breathing, and those things bring on a lot of stress and anxiety, which leads to difficult emotions, sometimes leads to temporary depression, feeling the blues, and sometimes to clinical depression. Then that brings on fatigue, and that leads back to the disease and the pain itself. So again, one of the key things that individuals learn is about the symptom cycle, and then they learn to understand when they're in that symptom cycle.
So we also talk a lot about a self-management toolbox, a range of tools that participants can use to help to self-manage their chronic condition or whatever their condition is. So healthy eating, fitness and exercise, stress management, some visualization, some mind management techniques, communication skills, difficult emotions, medications, healthcare professionals, treatment decisions, action planning, brainstorming, problem solving, and decision making. Now, just as my toolbox at home has a whole range of tools in it, and I don't use them at all on every job, participants don't necessarily have to use all of these things all the time. It's just some of them will be very, very appropriate depending on where they're at and what they're able to manage. So they can pick and choose amongst these depending on what they're dealing with.
So I'm not going to go through this one in great detail, but what we do is we give out this chart to individuals at the beginning of the workshop just to kind of show them the major activities that are going to occur and the weeks that they will occur. And there are some activities like, you'll see the second one down, making an action plan. That activity occurs every week. So every week they set an action plan for the next week. And then they'll report on how they did against the action plan at the beginning of the next session. And then there are other things that are just covered off in 1 week. Feedback and problem solving, we do a lot of that throughout the workshop, brainstorming, and also, there are many other activities, as you can see, that are covered off in the various weekly sessions that we do.
So what does somebody learn who participates in a workshop? So the first thing they learn is information about the program, from the material that's presented, as well as from other participants. How do other people hear the information and what stories do they have to tell? There's also a number of practical skills, how to get started with self-management, how to solve problems, because with chronic conditions, there are always problems that arise for various reasons. There's ways to communicate. There's ways to work with healthcare professionals, because with a chronic condition, you probably have a whole roster of healthcare professionals you're working with. And then how to deal with anger, fear, and frustration, which is common in health-related situations.
Other things they learn some very practical things, dealing with depression, dealing with fatigue, dealing with shortness of breath, evaluating treatment options. And that's where we get into the brainstorming and some decision-making processes that they'll learn how to make those kind of decisions and how to look at the different options as far as treatment and so on. In terms of cognitive techniques, they'll learn self-talk, to chat with themselves about the various options. They'll learn about how to relax their muscles. They'll learn distraction techniques. I think we refer to as guided imagery and visualization.
So some of the benefits, or what participants take away from a workshop, is they become aware of symptoms, like the symptom cycle. And some of those things on that cycle are not what we typically think of as connected to the illness. There's a self-management toolkit, which we went through. There's behavioral change experience, because in 6 weeks you can practice some of these things in between and other places. There's also some education and understanding that they take away. And they're able to start to map plans, hopes, and dreams for the future within the context of self-management. And they have a much greater measure of self-determination, commitment, and belief. And they have renewed energy, enthusiasm, and self-confidence because there's hope. Maybe that's one way to summarize it. They have some hope about how to progress and how to proceed and how to manage life as it comes up. And they get ongoing support from classmates and from UVic. Sometimes they take another self-management workshop for a refresher. And they also have an opportunity to give back as a UVic program leader. They could take the training and they could help to give back. One way to learn things is to teach it, or to facilitate it, or to participate. And that's also what is offered to
I know when I spent 3 years as a volunteer facilitator, one of the most amazing euphoric experiences I had as a leader was that at the beginning of the chronic pain workshop, we would get a blank piece of paper and have people tell us about, what their chronic condition meant to them, or their chronic pain meant to them, how it impacted their lives. And that sheet was quite negative and without hope. And at the very last session, the sixth session, we would do the same exercise and say, what does your chronic pain or chronic condition mean to you now? And the contrast was amazing. It was full of hope, it was full of optimism, and there was a sense that these individuals, given what they've learned, can now self-manage their own situation and be much happier and hopeful for the future. I think, to summarize some of the benefits, participants understand that they are their biggest healthcare provider. See, statistically, on average, we see our doctors and healthcare professionals about 12 hours a year, if you look at the average number of times we visit a healthcare provider. So that means that we manage our own condition 364 and a half days a year. And so we believe that self-management is essential, and no one knows us and our needs better than we do.
So when we've done 6-month post-program evaluations, these are some of the things that we learned. Participants believed they had better health. They're practicing more ways of coping with their symptoms. They had a higher level of self-efficacy to manage their symptoms. They had a higher level of self-efficacy to control and manage depression, to manage their disease. They were less distressed about their health condition. They were less limited in their daily activities. They were experiencing less shortness of breath. They were experiencing less pain and were less bothered by their illness. And they were using emergency and specialists less because they were better able to cope and to manage and to decide and to make decisions, all of these things.
So there are many, there are many benefits to the program, and certainly the province of BC see many benefits to the program, including less use of emergency and specialists, which is not necessarily driving the process and the program, but certainly is a factor. Another comment: when we say self-efficacy, it's a term that's used in academia, and really it means that people have more self-belief in their ability to manage their symptoms and so on. So just to talk about Vancouver Coastal Region briefly, it's an area that I took over in June, having done a number of years managing northern British Columbia. But it's a population of almost 1 million people that live within the Vancouver Coastal Health Region. And chronic pain and conditions within this area afflict thousands of adults, 1 in 3 in BC. So I would imagine a similar statistic in Vancouver Coastal Health. So it has a major adverse impact on individuals and also their families. And certainly I can speak of my own personal experience with my chronic condition. That certainly had an impact on my family and friends, and it's one that, they needed to be a part of my team, and they were. And also it has a huge burden on the economy and the healthcare system itself. So just to talk about Vancouver Coastal Region and my plans for 2019-2020. So given the stats and the number of people in my area, I really want to grow our presence and offer more workshops throughout the Vancouver Coastal Region and meet the growing needs for self-management. And, the main energy behind that is to support adults, families, the economy and the healthcare, but my focus is on the adults and the families that are dealing with chronic conditions. So in terms of what we plan to do, over the last 3 years, it's been in the 15 to 20 workshops a year. I would like to deliver, and I think there's a need to deliver 30 plus workshops a year. in Vancouver, Richmond, North Shore, and up to Squamish and Whistler, but mainly in our area here. So they're going to be mainly chronic pain and chronic conditions because that's where the real demand is, but some diabetes and cancer workshops, cancer thriving and surviving. This is for individuals that have been through, the major treatments for cancer and now are dealing with the more kind of longer term impacts and post-treatment situations, And so in order to do that, I need to train and cross-train more leaders, and I kind of have a team, again, of 30 plus active leaders in place, and maintain 15 or 20 regular venues. And these are places like community centers and healthcare areas that provide rooms at no cost to run the workshops. And in fact, at this point, we're in very good shape as far as venues. I have 15 to 20 venues, so I need to, certainly I'm planning a significant number of workshops already, and I need to build up the team to do that. So the venues themselves, I imagine that, I envision that they'll host 2 or 3 workshops annually, and they're primarily healthcare and community center venues. And some examples of that is that we in fact have run and are running regular workshop at BC Women's Hospital, St. Paul's Hospital, through the chronic pain clinic there, GF Strong, the rehab center. We have been running for a number of years workshops at the Roundhouse, Renfrew Community Center, Killarney Community Center, and actually many other Vancouver and Richmond-based community centers. We run workshops at the Richmond Center for Disability, City Center, Hamilton Community. We also do one in North Vancouver regularly at the Health Connections Clinic for individuals that don't have their own family doctor, and many of those individuals are dealing with other issues as well. And also the 55 Activity Center in Squamish. So with these and many others, we are establishing we have collaborative partnerships in place, and we're establishing additional ones with a few others. So how we work together, many of our partners, they check upcoming workshops on our website. Typically, they'll refer their clients and patients to our workshops. For individuals that they come across that are self-managing their chronic condition well, then they'll often refer those individuals that say, you're doing well. I think it might benefit you to become a leader if you're interested, and help others do the same. Other partners will promote our workshops. They'll put information up on their website. They'll put posters up in their facility, and they'll distribute brochures for people that are interested. And so I am constantly looking for collaborators within Vancouver Coastal Region where we can work together and help individuals that are dealing with chronic conditions. And also just to mention that my other coordinators for other regions are also looking for collaborators too. So if you have an interest in working with us, either you are working with Parkinson BC, or maybe you are looking after a support group, or you're a healthcare provider out there and you're interested in putting on a workshop or finding information about workshops within your area, you can go onto our website, and I'll give you that website URL a little later, and see the workshops that are coming up in these particular areas. Or if you want to set one up for a group, then you can either contact myself if you're in Vancouver Coastal, or you can look on our website and look at the information for the other regional coordinators. And there's a list of our regional and provincial coordinators. You'll see that Mark Davies, our senior coordinator, looks after Vancouver Island, myself, Vancouver Coastal. We have a fellow, Charles Levin, who looks after the interior. Louise Rowland looks after Sunshine Coast. Cassandra, Northern BC. Rhonda. Fraser Health is so big, we split it up into two. There's south of the river, and Rhonda Carrier looks after Fraser South. And then there's June Clearsky, who looks after Fraser North, and she's also our Indigenous coordinator for British Columbia. Courtney Kang looks after our programs in Chinese. Jay Baines in Punjabi. Lana looks after our online chronic conditions, and Karen Hanna is our health coach coordinator. The general number to reach any of those individuals is below, so 604-940-1273. So if you're in one of their areas, give them a call, or if you want to look at the workshops coming up, you can go to Self-Management BC, and there's a lot more information as well as far as who we are and what we do. Now, when Amy asked us to put this together, she said, when we do these things, often our facilitators will give us a top 10 tips and testimonials. So we did that. But one thing you'll notice is that many of the things on our top 10 tips are things that we presented as a part of the toolbox. And there's a reason, because, within the workshops, we learn those skills. And then I think Doug will agree that many of the things that we learn there, when they're actually put into practice, really, really help us and individuals with chronic conditions. So I'll go through them. Number one is making action plans. And this can be weekly action plans where you commit to yourself and maybe to others certain things that you intend to do during the upcoming week. And that could be, things like I intend to walk for 20 minutes 3 times a week. And then at the end of the week, maybe you meet with your family, as you've done, with your participants within a workshop, or you meet maybe with your family and others that you've shared this plan with. And at the end of the week, you say, yeah, I met my action plans. Yes, I did walk 3 times a week as I intended. But there's an important thing, and I think we do this in the workshop too, and I advise it, is to look at longer range plans as well. And look at, say, a 3-month plan where you might want to be in terms of, say, your overall exercise, physical condition, etc., etc. And when we say exercise, we really are talking about what we as individuals can manage. So, a walk for 20 minutes might be perfectly possible for one person, and maybe stretching 3 times a week is a more appropriate thing for someone else. So action plans, key thing. A regular exercise program for as much or as little as an individual can manage. Healthy eating choices. It's a big statement. It's a small statement, but there's a lot involved there, and certainly on the workshop we learn a lot more about that. Meditation and relaxation. Now, we don't use the words meditation in our workshop, but this is Doug and my top 10, so I can tell you that mindfulness meditation really helped me a lot, and learning to relax. And also, as is pacing yourself and learning when to say, no, I'm sorry, I can't do that, I can't manage that. So that's my 5. I'm going to let Doug give you the other 5 top 10 tips.
So something else that we have, which is number 6, is know your support team and ask for help. So understand where the different individuals in your support network or in your healthcare team are and how they can help. We also learn about brainstorming ideas, problems, and decisions is important as well. Many times we get focused on a road with tunnel vision or blinders on. We don't look at other options, but we learn a lot about brainstorming, and that's something that I apply and I teach in my classes at university and other places. We also have learned to stay current and be continually upgrading our education and research or awareness of our condition. And this doesn't mean we're taking PhDs or anything, but it's just being aware of how my body, my condition is changing, and how do I need to adapt or adjust to that. Number 9 is taking charge and being your own self-manager, because healthcare is complex. Many people involved, many professionals, different disciplines and so forth. And if I'm not aware of what I need to do or how all these people help, then I'll just be getting random advice, which doesn't help anyone. And of course, last but not least, and perhaps the most important, is to take a chronic conditions workshop, because you learn these and you work alongside others. You roll up your sleeves and practice these skills for 6 weeks. Then the habit is more likely to stick with you. So those are our top 10 tips.
And I think just to add to Doug's comments, I think, again, back to one of the key things you learn on the workshop, and the value of the workshop is that you actually experience behavioral changes over the course of 6 weeks. And, it often takes that length of time to actually get a full realization as to how life can be different, and that you can live better if you put some of these things, which look fairly simple, things like regular exercise, healthy eating. Sometimes it's the getting started and actually experiencing how life feels a little different in dealing with your chronic condition when you're well equipped to do so, and you've done it over a 6-week period. So yeah, and I'm going to, after Doug and I have talked about the impacts of being with you, Vic, and the workshop has impacted our lives, I'm going to present you an opportunity to take that workshop. So let me start off with a testimonial. In 2010, I took a slip and fall and smashed my head on concrete. And I went from a fellow that was running 6 days a week and working 5 or 6 days a week to someone that couldn't do any of that. And, cognitively I was impacted, physically I was impacted. I had mild traumatic brain injury, a serious concussion, tinnitus, I had loud bells ringing in my ear 24/7, and I was incapacitated. I'm a natural self-manager, so I looked for various things to do to try and heal. And after about 2 years of that, around the same time as I was thinking of doing the same thing, my doctor, who was a tremendous support person on my team, said, John, you need to maybe look at some volunteering to get back into something like the workforce and see how you do. And at the same time, I found a small ad in a community newspaper that talked about from UVic, SelfManagement BC, asking for facilitators for their workshops. And I thought, wow, that's for me. So I made a phone call, talked to my future coordinator for a couple of hours actually, and signed on and did the training, and then facilitated workshops for about 3 years until the director phoned me and said, John, do you want to come work with us? But, helping others really helped me. The other really strong thing was I learned a lot just by going through the training and teaching, and I learned and was consistently reminded of what I needed to do to take care of myself and helping others. And those two things in combination were a huge impact on my own recovery. Now I'm working 5 days a week and sometimes more, and I think doing a pretty good job. But I still do have some symptoms. I have migraine headaches if I stretch myself too far, and I get tinnitus if I'm really tired. But I now have the tools to manage it, and continue to do, and I have the joy and fulfillment of helping others. So it's been tremendous for me, and I thoroughly recommend it wherever I go. If I bump into people that are dealing with a chronic condition, or they have a family member that's dealing with a chronic condition, I am a champion for what we do. So, and I sincerely hope this information and presentation helps you all in that regard. So, Doug, your thoughts?
So, to give you a brief overview of where I've come from. So, I went through engineering, I have a master's degree. I was running companies, CEO of a tech company. 2015, I was diagnosed with MS, and that was a big hit on what I was able to do. Cognitive, brain fog, all these other things, mobility issues. trying to work through. And it's kind of an abrupt, as my neurologist said, you know, you point $1 million at something and you find stuff. So an MRI is about $1 million. And it's quite interesting, I guess you could say, in what they turn up, but it really changes your life. And so you need to think differently. And so then I went on a program of trying to figure out what do I need to do, find out which medical providers I need to talk to. What do I ask them? What questions do I have? What are the ways to heal, and all those, if that's even possible. So like John, I'm also a self-manager. And I happened to meet him at that time, and he suggested Self-Management BC. And so then I said, okay, well, volunteering is good. It's helped John. Maybe it'll help me. So then I looked up Self-Management BC and began to volunteer and to participate and facilitate workshops. And I'm always amazed. You look at some of the things on this slide that's up, the top 10 tips. All of those things are very, very simple things. They're simple to say and simple to read, but they're not so simple to do because you have to keep doing them. And I'm always surprised when I'm mentoring young entrepreneurs or young students or whoever else, how many times these concepts and principles come up in how they need to navigate their life because they're just trying to figure out what they're supposed to be and what they're supposed to do, you know, and how to think about themselves. And all of these things have come out in this workshop. So I get to participate in the workshop and help guide others this way, but also outside, there's other places it fits into life. And so that's, am continually surprised about that. Maybe I shouldn't be, but maybe I've been oblivious too long, but I'm not oblivious now anyway. So it's been a great experience for me.
Thank you, Doug. So, you know, back to our number 10 there, take a chronic condition workshop. If there is a demand out there, if you're looking after a group or helping a group, a support group, or if you're involved with Parkinson BC and you would like to set up a workshop for your group or yourself, or you'd like to talk about how we can collaborate together, if you're in Vancouver Coastal, of course, you can talk to me. If you're in another area, I will pass on you know, what we did in the presentation, and the fact I passed on the other coordinators' names to you. You can contact them through me or contact that through the general number. But back to number 10, take a chronic workshop. Here's a chronic workshop. We're actually doing one specifically for persons with Parkinson's and their families and friends and caregivers. It's been set up by one of my colleagues, June Clearsky, who looks after Fraser North, and it's being orchestrated by Impact Parkinson's in New Westminster, and it starts on March the 7th to April the 11th. It runs to April the 11th, 1:30 to 4 in the afternoon. And as well as seeing this information here, you can go to our website at selfmanagementbc.ca and look at the map, click on Fraser North, and then you'll see the workshop there, and you can actually sign up online on the workshop, or you can phone our general number 940-1273, and our friendly registration staff, Christine and Norma, will sign you up. So there's one opportunity, and of course we're hoping that we will set up many other opportunities for individuals or groups. You know, it's not necessarily that you have to sign up for a Parkinson's specific workshop, but it's totally okay if you want to set up a workshop for a group. But you know, if you are dealing with Parkinson's and you join a chronic condition workshop, for example, as we've mentioned before, those individuals at the workshop will most likely be dealing with different chronic conditions, but the symptoms are often the same. And the value of talking to people that have different chronic conditions and are experiencing the same kind of symptoms is really terrific. So that concludes our webinar for you. I've left my contact information up there with my direct number, my email address. There is the selfmanagementbc.ca website URL. There's a wealth of information on that website, not just about the workshops and programs, but about the research work that we have been doing over the last 16 or 17 years. And please pop in there and take a look, give some thought as to a workshop we might be able to run for your particular group. And anyway, in closing, thank you so much for the opportunity to present to you. I hope the information's been thought-provoking and useful, and I do hope many of you look at the workshops and decide to sign up and reap the benefits. I cannot speak highly enough about the benefits associated with attending from a personal perspective. So thank you very much. Warm wishes to everyone, and Doug, I'm sure you'll agree it's been a good experience and really appreciate it.
Yeah, we appreciate the opportunity to speak with you.